Well, so far, the information that we've heard about the efficacy decreasing and the information that Pfizer has been sharing verbally about the booster increasing efficacy up to 10 times as much. Local experts I've spoken with say there hasn't been a report issued. There's nothing they can actually read through, and it hasn't been peer reviewed. The other issue at the core of this all is, what is the goal for vaccination? Is it to eliminate COVID-19 altogether or just reduce severe illness? To boost or not to boost? That's the question.
What is going on here is a question of what the policy is and what the goals of vaccination are.
Is the goal of vaccination to eliminate COVID-19, like smallpox, or just reduce the risk of severe illness, like the goal of a flu vaccine? This week marked 7 months since the first American outside of a trial got a COVID-19 vaccine. Since then, hundreds of millions of Americans have rolled up their sleeves too. More than 56% of people over the age of 12 are fully vaccinated here in the United States. Now, a senior health official says Pfizer will brief government officials about the potential need for a booster dose of its vaccine after Israel released data showing a marked decline in its effectiveness from more than 90% to about 64% as the Delta variant spreads. Now, Israel will offer a third dose of Pfizer's vaccine to people who are immunocompromised, and the UK announced last month it might offer boosters too. But the CDC and the FDA say Americans who have been fully vaccinated do not need a booster shot at this time being key.
That doesn't mean we stop there. There are studies being done now, ongoing as we speak, about looking at the feasibility about if and when we should be boosting people.
And who should get that booster? Getting FDA approval and formal CDC recommendation, though, takes time.
That's a multi-month process. So if we don't get started right now, we're not going to be in a position to have boosters available should we need it come the fall.
It might be good to have these booster shots on the shelf, but if we have to divert production to development of booster shots for those who are already vaccinated, I don't think that's a wise move right now.
There's a lot of discussion here about what the data shows, and there are different sets of data, whether you're talking about the people who entered trials a year ago or 7 months ago when vaccinations publicly began. So that's going to be a topic of conversation in today's meeting. And later on tonight at 6 o'clock, you're going to hear more in depth from a number of experts we spoke to, looking at multiple sides and multiple layers of this big question, whether we need a booster or not. Reporting live, I'm Jennifer Ann Wilson, 7 Action News.
All right, of course, we're all going to be watching that because it's going to affect tens of millions of folks all across the country.